Thank you for joining us this evening. A week ago, we took you inside Methodist Hospital, showing how the surge of COVID-19 patients has overwhelmed the health system's resources and the doctors and nurses tasked with saving lives.
But as we inch toward a full 2 years of this pandemic, this load is getting heavier and heavier for frontline workers to carry. Local 5's Mary Sugden spoke with them on how the pandemic has impacted their mental health and what they say they need the public to better understand.
Meet Brent Beeman.
I've been a registered nurse for coming up to 33 years.
A nurse with decades under his belt, none of which prepared him for the last few years in the ICU.
This has been nothing we've ever seen before. I have nothing to compare it to.
Meeting people, many on their worst days, forces him and his coworkers to try and stay positive.
I think we've learned to celebrate when things go right.
Moments like a COVID patient getting off a ventilator or recognizing family members.
But I'm not going to lie, those days aren't often, and they're not nearly as joyful now.
Because those brief moments of happiness become harder to find behind dark clouds of despair.
And then it's someone else passes away that you thought was going to do okay, someone even younger than yourself, or the age of your nieces and nephews, and 2 days later you read their obituary in the newspaper. That's been the hardest thing. That right now I think that is our biggest battle, is the mental battle.
A battle not easily won.
I don't think a lot of us have processed it. We've lost a lot of staff members too that burn out.
I think it's typical for a nurse to come into her shift feeling anxious before she even gets to the hospital. I drive 45 minutes every day, and I know on my way to work I'm already thinking, what's it going to be like today?
And while these nurses knew they'd face a lot of loss in their career, after 2 years of intense loss, it gets harder to process.
What scares me most is it's people who are my age or even younger that I've seen die on the ventilators, people with young children. It's been the worst time in my 10 years.
They say pre-pandemic, after the loss of a patient, they likely get time to process and take a break before re-entering the shuffle, something that's rarely possible now with such a high patient volume.
When you're doing it every day, sometimes more than once in a day, where you're having to say goodbye to family and a patient, that doesn't work.
Something that follows them home even after they clock out.
Even if you have a day or two off, at this point in time you're thinking, I have to go back in a day or so. What's it going to be like? I wonder how it is for my nurses that are working right now, my friends that are in the hospital.
A burden as well for managers, knowing the toll this takes on their staff.
I'm constantly thinking of how I can protect all my nurses and keep them safe and keep them, keep their mental health where they can keep going and doing their jobs.
And now these healthcare professionals say some patients they're caring for and their families don't trust them.
I think what frustrates us the most is people are being mean now and hurtful, and think that we're trying to hurt family members, or we're doing things worse to them and trying to make them die.
A shift, especially from how they were treated in the beginning of this pandemic.
I mean, we went from heroes now to people hating us. I've never ever had that feeling ever before. It's sad. And it's sad.
Which also adds to their frustration, knowing there's a simple solution.
The thing that now is so upsetting to all of us is we have the tools. We have a great tool out there, and it's called a vaccination. And for some reason, the politics started. But I'm not a politician. I'm not running for any office. And if I could just tell everyone, get the shot, it helps. It helps greatly.
For this nurse, the moment he was fully vaccinated is one he'll never forget.
I was the first one to sign up. And I'll tell you, when I got my second one, I cried that day. For the people that couldn't, and the people that wanted it and were trying to take care of themselves, and it didn't happen. And so that day for me was just like a light bulb that, thank goodness we have this tool. It works.
That was Mary Sugden reporting. These nurses also urge people to be respectful when it comes to visitor policies limiting the number of people allowed in. And they ask you don't take your frustrations out on them or those frontline workers.